On today's podcast today, I have a great friend of mine, Lacey Meeks. So Lacey Meeks has been doing medicine for a couple of decades now, and she focuses on functional medicine, pediatric health, sexual health, hormones, weight loss, and longevity. We did a wide-ranging podcast today. We talked about functional medicine, weight loss, GLP-1s, longevity, sexual health, and the new phase of her practice here in Lubbock. So I think you're going to enjoy this podcast, and I would encourage you to go to their website for more information. So Lacey, thank you for coming back on. As my podcast peoples, y'all may remember, you were one of my first guests when we had a crappy interview, crappy camera, bad Zoom, and I appreciate coming back on. So for people who don't know you, tell us a little bit about who you are, where you practice, and what you do.
So I'm Lacey Meeks. I'm a nurse practitioner. I have a clinic in Clovis, New Mexico, and in Farwell, Texas. I've been in family practice for almost 20 years, and I am shifting my practice right now to functional medicine, longevity, more holistic root cause type medicine, effective September 1st.
That's exciting. So that's exactly what I want you to get you on, because we have a lot of patients and a lot of people who are interested in functional medicine and see this as a better way of medicine. So what exactly is functional medicine? What does that mean when someone says they practice functional medicine?
So I think about functional medicine more root cause, looking beyond the symptom and trying to figure out what actually caused the problem in the beginning, whether that's a chronic illness, whether that's a symptom. Maybe you're having anxiety all of a sudden. What's causing that symptom of anxiety? Is it a true diagnosis of anxiety, or was it something underlying? So it's really fun to me to get to that instead of just trying to give you a prescription to Band-Aid whatever symptom you're coming in for. And then you need another prescription to take care of the symptom that medication caused. And again, I believe in conventional medicine. There's absolutely a time and place. There's a time for blood pressure medicine, and there's a time for diabetic medications. And if you have a urinary tract infection or you have an infection, absolutely you need antibiotics. But how many times can we prevent an illness or a disease process before we ever get there?
Yeah, I think we all understand that medicine now is more reactionary. Now you have diabetes. Well, okay, we'll treat this now, but how do we get there? Now you have high blood pressure. All right, we could have prevented that. What in your medical experience kind of caused that shift to occur where you really want to understand the root cause of what's going on and fix it in the beginning as opposed to being reactionary and, fixing it when maybe you've already crossed that bridge?
Yeah, so that's a sequence of events in my opinion. For me, it was my own health, having autoimmune disease, underlying just chronic fatigue, not feeling well. I've had acid reflux since I was 18 years old, took medication for that, proton pump inhibitors. Again, there's a time and a place. I think they're a great tool in the toolbox. I prescribe them in my practice. But I had Pepcid, I had Gaviscon, I had Tums in every single vehicle, and anywhere we went, it was in our backpack. And I went, okay, if you're going to teach somebody that maybe we don't need all of this medication, or maybe that is actually causing gut issues, then you got to practice what you preach. So that kind of took me down a rabbit hole on my own, and I have officially been off of proton and pump inhibitors for the last about 10 weeks. It's not been 100% clear, but what a lot of people don't realize is the acid reflux is not due to an overproduction of acid. I know you know that, being in your field, but I've been able to take care of that. But really, it goes all the way back to our daughter, who's fixing to be 9. She had tummy issues since she was little bitty, skin issues. We had her to doctor after doctor, and it was like, well, here's a pill. Well, then that would cause her to have kind of mental health issues from the pill, or they would say she wants to sleep in your bed. And I remember Briar saying to us one time, she said, the doctor told her, it's because you sleep in mommy and daddy's bed is why your tummy hurts. So she went home, she slept in her own bed, for like a week, and she came back and she was like 4, and she told Keith and I, and she said, that doctor lied. Yeah. I said, what do you mean? She said, I've been sleeping in my bed for a week and my tummy still hurts, mommy. So really, at some point, you do have to believe what they're saying. It's just like patients, like it's subjective. What you say is, we need to hear you. And I think sometimes in conventional medicine, we don't have time to hear you. And that's really unfortunate because we are insurance driven. We are restricted by how much time we can spend with a patient. So that's the beauty of functional medicine, holistic medicine, of finding that root cause. And for Briar, that was doing a GI map, finding all these things, changing nutrition, changing diet, sugar and dye being number one. I know you hear it everywhere, but it's true.
It's true,
and when she has just a little bit of it, unraveling that, the damage and the repercussions, they last a week. And you have the older generation say, oh, well, you ate that when you were a kid. It was different when we were kids.
Yes,
it wasn't high fructose corn syrup. It wasn't Red 40. And even now, in the position I'm in as a mom and in this functional medicine space, I'm still learning things looking at ingredients. Ketchup's the biggest thing right now.
Yeah.
Finding unsweetened, real ketchup was a challenge.
Yes, it's
and guess what?
challenge.
When I first tasted it, I wasn't impressed with it. Our kids love it.
Yeah.
Why do we need to put red dye in ketchup?
Yes.
Or in strawberry jelly? We don't need those things.
Yes.
So that's kind of what led me down that road, but also just being in practice for 20 years and seeing these patients day after day. And I really feel like I've always kind of been on the holistic functional medicine side. I've always tried to help patients with how can we do it naturally, but I didn't have that time to spend with them, you know, and if I did, then that meant on the back end I had to go home and work on charts until midnight or in the car every single time we were going. So, and you know, functional medicine, I think it really did come, people started questioning the medical system after we went through a pandemic. Wherever you stand on that, they went, what else can we do? How can we be preventative? And I think that is what has kind of led into this.
So you bring a lot of excellent points, and I think one of the things that hits home for a lot of people is your kids, because I think a lot of us understand intuitively, you know, our kids act up, they have some sort of illness. Commonly, you may go to a healthcare provider and they may give you medication, they may kind of give you something, but you know deep inside, hey, I don't know if this is the right thing for my kid, and I don't know if we're actually understanding the true cause of what is going on. So I think a lot of people really can appreciate that and understand that, because that makes, I mean, complete sense to me. I mean, if my kids were acting up and I think the root cause is food, which I do believe. And if I went to a provider and they gave a medication instead, I'd be like, is that really the real reason? Is that legit? Are we sure about that, you know?
Right, and I have a fantastic pediatrician that works along hand in hand with me and alongside me, and we've learned from each other of just really interviewing those parents. Let's not just give you a pill, let's not just cover something up. The other thing that I've really noticed is eczema. How many children have we dealt with that have had eczema? I did not realize until I got into this space that skin issues are gut issues.
Yes.
And if we don't take care of the gut, I can give you all the steroid cream in the country, I can give you biologics, but I'm not fixing the problem.
Yes.
And I had psoriasis myself. Guess what? I'm not on any medication anymore for psoriasis because I've worked on my gut. Was it overnight? No. The cup didn't start tipping, you know, at 40 years old. And especially now with our pediatric patients, that cup is tipping much earlier. So then trying to get that cup back upright and getting them on the right track is difficult. You know, I've had this conversation with our school leaders in Texaco. We reward these kids with snacks. We reward them with popsicles. We reward them with pizza, with cookies, with ice cream. And then you want them to sit down and be quiet and learn. They can't. They physically cannot do it. So that's difficult. How do we get that? Because the state is regulating what kind of food they're getting. Yes, we send food with our kids. And what do our kids come home and say? Well, how come I can't have the food that my friends have? And why do kids need to snack all day long at school? This is the conversation that I had with the principal the end of the year. They are metabolic. We have so much metabolic dysfunction in pediatric patients today that we didn't have years ago. Our bodies were not meant to snack all day long. You know that.
Yes, you're 100% right. Yeah, you know, I'll tell you a story of our kids is that, you know, our kids also suffer from eczema or acne issues like that. And you're right, you know, traditional medicine, which is okay, which is perfect. You know, I'm a doctor, you're a nurse practitioner, we're in healthcare, we train like this. You know, our allergist wanted to prescribe biologics. I was like, you know, she's only 10. Are we sure we're going to go down that route? And so we really did a deep dive in terms of what she's eating. And yeah, we figured when she eats a certain way, her skin flares. It's clear. Like, I don't need like a scientific evidence or a panel to tell me that. I can see it. And when we made the changes in her diet, her skin does well. And if she actually binges with her friends, she knows she's going to suffer a consequence from this. So you're right. There is a connection between the skin and the gut. Now, going back into functional medicine, so we understand we're going down to the root cause of what's going on there. What are some of the causes of healthcare that we're seeing in the functional medicine world that we may not be understanding in the traditional medicine world that we have right now?
Well, I think you are just not being regulated by insurance companies, number one. When you're in functional medicine longevity, most of us are not taking insurance because we don't want to be regulated by it. We don't want to be handcuffed by what the insurance is telling us that we can run on you. Is there some more extensive testing, advanced testing that you and I can't run in conventional medicine? Number one, it's a specialized lab. Number two, insurance isn't going to cover that, and we know it. But number three, if we run all of those things, do we even know what to do with those results? And in conventional medicine, we don't. That's not how we were trained. Again, it's no fault to healthcare. it's just, we're trained a different way. We are trained to be reactive instead of preventative. So can we start looking earlier to prevent cardiovascular disease and gut issues and even cancer and Alzheimer's and dementia? Yes, I believe we can in functional medicine. And I think that's where we kind of fail at that healthcare point. And part of it is that patients aren't coming into the healthcare system until they have a problem.
Yeah.
So you're not seeing somebody till they already have the issue.
Yeah.
So it's really hard to be preventative.
Yeah. Well, they're already there.
They're already there.
Exactly right.
So
when you say you're able to spend more time and really get down to the root cause, what does that actually mean? Because you're in more clinics, it's just go and go and go. 10 minutes, 5 minutes. You got this, you got that. Take this, take that. How is it different in a functional medicine practice? Where you're able to, how is that different from what most people are aware of when it comes to medicine?
So just taking, for one, my intake forms are a lot more extensive. Yes, you may get 20 pages in a new patient packet from my clinic, but that, number one, tells me, are we a good fit? Are you willing to work on the things that we need to work on in the functional medicine spectrum to get you where you want to go? Because if you're not, I'm wasting your money. Yeah. I want to go to bed at night and I want to feel good about it. I don't want to take a bunch of your money and then you're disappointed in the end because you're not willing to do the work. So my intake is a lot more extensive. My office visits are 45 minutes to an hour. And then after we do advanced testing, then we sit down and we go through that. Maybe advanced testing is not needed, but yes, it's pricier than traditional healthcare is. I mean, we pay $3,600 a month for health insurance for a family of 6. So I get it. I want to use my health insurance too. But I see a functional medicine provider myself out of pocket because I want that preventative, because I want that one-on-one time. And I get it that some people can't, which is why on my Facebook and on my website, I intend to give as much free information as I can, because there are people out there that will utilize what I recommend, what I talk about, what they see, and they deserve it.
So talk about the motivation of a patient, because you mentioned that. And I think there are people who may assume that you go see a doctor who's in functional medicine, they'll give you everything, you'll be fixed automatically, you don't have to do any work. It takes work.
Right.
So explain what you mean by that.
And I think that is a lot of times that patients come in and they just want a pill, they want a quick fix. Mm-hmm. That is not what functional medicine is. And it's kind of a joke, but it's real. If you come in and you sit down in my clinic and you say, hey, Lacey, I'm going to see you for functional medicine. My first question is, why are you here?
Yeah.
And if the answer is because your wife made you come here, you and I aren't going to work. This is not going to work for you.
Yeah.
You're not invested.
Yeah.
You don't care about changing, or maybe you do a little bit, but if she's the one dragging you here and pressuring you, it's not going to be successful.
Yeah.
So we've got to be a good match. So I interview the patient. Like I do an initial visit. Let's talk about it. What are you wanting from functional medicine? People come in all the time, and I know you're hearing it. You're seeing it on TikTok, on Facebook, on the internet. They're like, I want peptides, Lacey.
Yeah.
And I'm like, okay, so let's talk about that.
Yeah.
What do you want? What do you know about peptides?
Yeah.
That's the first question.
Yeah.
And then the next question is, what do you want the peptide to do for you?
Yeah.
99 times out of 100, they have no clue.
No idea.
I saw it on TikTok. My friend's taking it, you know. That's not a good reason to be on peptides.
Yeah.
I think they are a great tool in the toolbox. They're a great building block. There's great places for peptides. But if you don't have everything ready to accept that peptide, you're wasting your money. It's like supplements. If you can't absorb it, if your body's not ready to take that and utilize that supplement, I'm selling you expensive urine. And at the end of the day, you're not happy with that.
Yeah.
It's the same thing with peptides. And patients will come in and they say, well, you're really expensive. I am expensive. My knowledge, my credibility, but the pharmacies that I use are expensive.
Yeah.
This is a 503A compounding pharmacy. They're 503B compounding pharmacies on my hormone side of things. They are credible. We have vetted them. We know where they are sourcing their chemicals and their medications and things like that on your peptides. So no, I'm not the cheapest, and I'm not going to be the cheapest. But I also know that there's peptide stacks out there that they're mixing all of these peptides. And when you really break down the chemistry, some of those are not meant to be mixed.
Yeah.
So they can actually do more harm than good.
So talk about the importance of finding somebody who actually knows what they're talking about. Because I think you're right. Unfortunately, we got into this situation where we TikTok everything, and people are buying things left and right from the internet, from TikTok shop and whatever, and they don't know what they're taking, they don't know how it's taking, they don't have any supervision. So talk to me about the importance of actually seeing somebody who knows what they're doing, has the knowledge, it can guide you, because a lot of people just don't understand the importance of that.
And that does matter. You know, peptide certification. I mean, I have gone to conference after conference, but I actually have a certification in peptides.
So what does that mean then?
So that means you go through a total certification course. You have to pass the test with a 90 or above, or you don't get the certification.
Yeah.
And with that being said, the company that I go through, you have to be certified every 2 years to keep your certification up, because things, as you know, are rapidly changing. From the last time you and I talked, things have changed in the peptide world. Some for better, some for the worst. So are you staying up with that? But it's just not every 2 years for me. I read a research article every single day, at least one. That's my goal. And break that apart and see, okay, what are we using and why are we using that? Because if you come in and use, I mean, there's a great peptide out there right now that can cost patients $2,000 or $3,000 for an 8-week course. Well, as I begin to dig deeper, if you don't have all of these other things, whether that's an extra supplement, an anti-inflammatory, do you have the gut right? All of that medicine that you're going to give them for 8 weeks will do nothing for them. Well, you're not going to trust me at the end of the day if I took several $1,000s of your money and you got no results. That's a big deal to me. So I always say, when you go in and you find the provider and you want peptides, I think reasonable questions are you certified? What's your education? What's your knowledge level? How do you stay up on continuing education on peptides? And if they don't do a really valid health history on you and do some blood work, I mean, let's at least look. Yes, these are what they consider natural, or they're what our own body is making, but you and I both know that those can still have consequences at the end of the day. So even like peptides that are like growth factor, they can make things grow that you don't want to grow. You know? So, I forgot to tell you that I had breast cancer 40 years ago. Well, that could cause growth. So if we give you something that's going to grow something, you don't want a tumor growing. I don't, you know?
Exactly. I don't think anybody does.
But how many times are these people going online and they're ordering these products and there's no health history? Who is liable? Who's responsible for all of this? And then you get it and it's like, is there lead in it? Did the products come from overseas? Where there is no regulation whatsoever.
So I think the important thing which you just mentioned is, when people try to do this thing on their own, we don't know what we're getting in terms of peptides, the quality, the efficacy, does it work, what the combination is. You don't know who you're getting it from. Are they even somebody in healthcare? Is it some rando on the street selling things? Do they have certification? Do they have knowledge? These are things I think a lot of people don't realize that are important. And by having somebody who's like you, who's certified, who knows, who goes to courses, who is knowledgeable, and is willing to say no to somebody who doesn't, have the right intention, I don't think people realize how important that is to find the right person like that. Because anyone can get peptides, but getting the right peptide from the right person is probably what's key.
Absolutely. I agree 100% of going. And it's not just about peptides. Like, are your hormones balanced? Are your micronutrients balanced? Maybe you don't need peptides. It may not be the right option for you. Or maybe you're going in for a joint replacement. Maybe we just need to do a peptide stack. I call it an orthopedic package. Maybe that's just a 12-week package to help you with the healing process, to help you get the best benefit out of that joint replacement. Because certainly there's a time and a place for those too. And there's no other option. You got to have that done. But can we support the healing and the immune function and things like that to get you a better outcome after you have that joint replacement? So
let's say I'm a patient and I am motivated. I have issues going on with my gut, my skin, joint issues. I'm getting older. I just don't feel good. Let's say, yes, I like the way Lacey talks about getting down to the root cause, understanding what's going on, being prevention. I want to live a better life, especially in my later half of my life. I came to see you and say, hey, Lacey, these are my goals. Maybe kind of explain to our audience, like, how do you approach a patient like that? Because for me, that seems like very overwhelming. Like, oh my gosh, what do I do? I can do everything. So how do you kind of approach a patient like that can maybe give our people who are watching an example of what your clinic is like?
So the first thing is that intake form. I email it out to you. I get all of that back, and then I look over it. If you've had any recent labs, maybe from another provider in the last year, I like to look at those for the last year. Let's not duplicate what's not necessary at that point. And then let's have that initial consult, and that is that 60-minute visit. I can do that telehealth. I can do that in the office. I'm personally like face-to-face if you're local, but I do see people all over, so that telehealth visit is important. At that visit, history. I mean, really going back to the basics of what they taught us in medical schools, nurse practitioner schools, nursing schools. 20 years ago, it was talk to the patient. I will probably learn more about you in conversation than I will from a piece of paper or from blood work. And then after that, let's make a plan. What advanced lab testing do you have? Maybe you have a history of high cholesterol, and we need to look at inflammatory markers, because cholesterol doesn't tell the full story. Your cholesterol number, know your number, was the big thing before on cholesterol. Now it's vitamin D. But that doesn't tell the full story. So maybe you need advanced cardiac markers, and that's your focus. If it's gut issues, skin issues, things like that, a GI map's where I'm going. It tells us so much about the gut. We know that butyrate, acromantia, those are big things that are depleted in the gut. And rather than just, yes, I can sell you a supplement it's a great supplement, third-party tested, that has those things in it that will take care of it. But a lot of people just want to know, where did I start? And then in 6 months, they may want another one. Then let's redo it. But let's not supplement you to death. Let's really look and see what's causing your issues, and just bringing to focus, what are the top 3 things that are bothering you today? Because I can't fix 17 things in one visit. So my typical package is a 5-month program, and I'm going to see you 6 or 8 times in that 5-month program. You have access to me. You're going to have access to a health coach, and we actually do a nutrition plan. We do an individualized treatment plan based on your blood work, your symptoms for every single patient.
So what are some of the more common problems that you're seeing that patients are making that really leads to the problems that they have down the road? Like, what are you seeing that is kind of the root cause for the problems? Is it diet? Is it sleep? Is it micronutrients, microplastics? Like, what do you feel like in your knowledge is kind of the issues that we're having?
Most of it's all things that we can change for free.
Okay.
It is sleep. It is morning sunlight. It is exercise, stress reduction, breathing, just breathing, just 5 minutes at your desk 2 or 3 times a day. It matters. Lots of good research right now on walking after every meal. It was, 10 minutes, then it was 5 minutes. I just seen a research study in the last week that even 3 minutes postprandial, meaning after you eat, will decrease your blood sugar. I love continuous glucose monitoring. I wear it myself. I kind of call it the police on your arm. It keeps you from eating things that you don't want to see the spike. But insulin spikes, metabolic dysfunction is the driver of cancers, of Alzheimer's, of heart disease, of type 2 diabetes, kidney, liver issues. So if we can keep you, metabolically level, meaning keeping those insulin spikes normal, know your number on your insulin. Normal is 3 to 21, but we know that optimal really is 6 and below. And we will see an insulin level begin to rise long before a fasting blood sugar will. That tells us about metabolic dysfunction. What is your high sensitivity C-reactive protein? What is your A1C? Have you checked an ApoB? Have you checked an ApoA? And not just a total cholesterol number. So metabolic dysfunction, I think, is the driver to many of these, all the way from the pediatric patient to the adult population.
So one of the things that you mentioned, which it's a great comment you made, is that a lot of it's free, changes. So one of the things I've heard in terms of why people are a little bit more skeptical about functional medicine is that, you're right, it is free. Why am I paying for something that I already know what to do? Most people know not to eat bad. Most people know to not junk. Most people know to sleep well. Most people know not to have stress. Most people know to get outside and exercise. So 2 questions. One, why would someone, want to go see somebody who's going to tell them similar information? Then second question, if we all know this, why aren't we doing it? So give a thought on any of those 2 things.
Sometimes when you're invested in something, you will do it.
Yes, that's
sometimes
true.
You need that handhold. And it's like, man, I'm paying this lady, So, and sometimes the reality is you really don't know what to do. I have a nurse practitioner right now that said, I don't even know what to eat anymore. Like, what is healthy, Lacey? Because it changes all the time. How many ingredients are healthy? Well, this ingredient isn't healthy. Well, I need to optimize protein. But all these protein shakes, all these protein muffins, do they really have the ingredients we need to get the right protein? So sometimes just walking with those patients and going, okay, let's change these things. But yes, I still think there's a time and place that looking at that micronutrient and telling you why you shouldn't buy supplements off of Amazon. If you put it in your mouth, you probably shouldn't buy it on Amazon. Whether that's supplements, whether that's food, you don't know how it's stored. You don't know where it's coming from. But you need to know, because those things without a true treatment plan that's individualized to you can cause more damage than good, or you get no benefit at all, and you've still spent the money at the end of the day.
So you also mentioned longevity. Let's talk about this, because this has been a big push, Medicine 3.0, Peter Attia, a lot of thoughts on longevity, and the idea is living your last lives better, your last part of your life better, fuller, and just you're not just handicapped. Talk to us about how that plays a role and your inspiration to do that, and kind of what are some of the goals when it comes to longevity? Because I think people assume, well, I'm going to live longer, like 100 years.
Right.
But I don't think that's quite exactly what it is.
Yeah, so longevity is more about health span than lifespan, meaning how many good years are you going to get in life, not how many years are we getting out of life. Because for me, yeah, I want to live till I'm 100 if I can be independent. I don't want to be in the nursing home for the last 20 years of my life. So in the longevity space, what are we seeing that's kind of at the forefront? What do you think it is? What do you think number one is for longevity?
I would assume it's similar to functional medicine metabolic, but I'm curious to hear.
So number one is social interaction for longevity.
Social interaction. So
it's free social interaction.
Really? Okay. So what do you mean by that?
And it's just getting out and interacting with people.
Yeah.
So the more you do that, the longer you live. It's
Yeah.
proven. Number two is muscle mass.
Muscle mass.
Well, you
Okay.
can work out at home.
Yeah.
You know.
Yeah.
I mean, yes. People are like, well, that's expensive, Lacey. No, it takes work.
Yeah.
It's not free and it's not easy because you do have to put the work in.
Yeah.
But it's social interaction and muscle mass. Those are the two things that are the biggest in longevity right now.
Yeah.
VO2 max is actually the metabolic marker to look for longevity in life. But for me, my tagline on my new business is your next phase should be your best phase.
Yeah.
I don't care where you are in life. Let's make the next phase the best phase.
So when you say social interaction, does that mean that, and maybe we can just be black and white on this, the less interaction you have with people the more likely it's going to be you're going to have worsening end of life. Is that correct?
That's exactly right.
So
Yep.
with respect to that, we are living in an age where we are isolated. We have
Correct.
social media. We're always on the phone. We're not out anymore. We don't have communities. So it seems like we're going against a huge tide
Right.
that's preventing us from doing that. So how do we overcome that? Because it seems hard. I mean, really hard.
Even going back to our kids.
Yeah.
Our kids are outside 11 hours a day right now in the summertime. The neighbors are complaining that all these kids are on their scooters and riding around the neighborhood. And I'm like, listen, they are socially interacting with each other. They're not on their phones. They're not on electronics. And they're active.
Yeah.
They're walking miles a day. They're riding their scooters. So it really is about and it's discipline. And it's hard.
Yeah.
I'm guilty. It's like, I got to check these emails. I need to respond to this. I need to do that. And your kid's talking to you and you're totally ignoring them. You're missing it. And at some point, they're going to stop talking to you if you don't put that phone down and listen to them.
Yeah.
But I see it even more in adults. How many restaurants do you go in? I go into a patient exam room, and how many times do you see a couple and they're both just like this?
Yes.
They're not talking. They're
Oh
not
my
making
gosh,
eye contact to
yes.
each other.
Yeah.
And I'm like, man, this is a fun room.
I know, exactly right.
But I do think that they lack that communication.
Yeah.
You see it in everyday, even in the workplace. How many times are you going into a place and you have the next generation working on with you? They can't even carry on a conversation with you. They can't look at you in the eye.
Yeah.
They have no eye contact. Another article I read today or maybe yesterday that said this is the first generation that is younger than us, that children will die or be sicker than their parents. This is the first generation that's ever happened.
And do you think it's driven by
sedentary, metabolic dysfunction, food sources?
Yeah.
I think it's all of those things.
So you also talk about muscle mass. So when people hear about muscle mass, they assume that you got to be swole, big,
Right.
full of muscle. So tell me, what do you mean by that, and how is that a marker of longevity?
Yep. So weight training 3 days a week is what I tell patients. It's as simple as I've had patients in their 60s and 70s, and it's do 10 squats every time you go to the restroom. Body weight squats, that's it. Some little 5-pound dumbbells. Grip strength is a big marker of longevity right now too. We think about that. When you've got to get up off the toilet, when you have to get out of bed, when you have to sit down on the toilet, when you have to bend down to grab something or to tie your shoe. Think of all of those muscles that you're using. If you need, a knee replacement, what do those muscles look like in the leg? What do they look like in the hip? What do they look like in the back? And if you haven't strengthened those for many years, you're not going to recover as well. You're going to, at some point, have a mobility issue. And when you start losing your mobility, you're losing your independence.
Yeah. Unfortunately, I think I've seen this in family members as well. And the minute that you can't move, or you don't have the strength to move, you don't interact. You don't have social interaction. You fall, you break something. You don't have that exoskeleton to protect yourself. I think
Right.
you're 100% right on there. So we're talking about longevity. We probably have people in our audience who are maybe older. They're hearing this, they're scared, like, oh my gosh, what's going to happen
gotta
to
start
me?
working out.
Yeah, I know. So let's say that we have somebody who's around that age, 60-ish, who really wants to make sure their later half of their life, they see where they're going now. Like, I do not want to go there. I want to go down to a path where the quality of my life is so much better. What are some practical tips that you would maybe give that individual that would help them to achieve that longevity, live a good life, that focuses on the things that we're talking about right now? Like, what can they do today to help out? What are the first steps?
Number one is you're not too old to get in the gym.
Okay, perfect.
You know,
that's incredibly important. Yes, yes,
there's not an age limit. I seen a video the other day that was just, I should have sent it to you, it was great. And it was about all of these people that were like in their 70s and 80s that were athletic. And one was a couple, they were 80 years old and they're still long jumping together at 80 years old. And my kids even go, how did they not break a hip, Mom, or a bone, you know? It's because they've been athletic and they've kept themselves in shape. But yes, it's going to be hard in the beginning. If you can just, even sometimes, depending on where you are weight-wise, where you are health-wise, maybe it's walking to the kitchen table and back 5 times a day, just starting to get those muscles moving. And then let's start just doing some weight-bearing exercises, or maybe it's just body weight. It's just simple moving those arms, getting 2 canned foods in the pantry. We've heard it 100 times, but it does still work. It's going up and down a step in your house 2 or 3 or 4 times, you know, obviously assuming you have good stability and mobility, but start somewhere and start now. And whether that, if you're 20, if you're 30, if you're 13, get your kids in the gym and make that habit now. And they do what you do. They watch you and they want to mimic you. So if you're a parent at home that's struggling with kids that either you can't get them off the couch, you feel like they're lazy, or maybe you are seeing their weight start creeping up, just lead by example.
Yeah, I think that's great. And I think you hit the nail on the coffin. You are never too old to start. And I think people underestimate the power of simple exercises, even when you're late in life, how much benefit you're going to have from that.
Right.
So let's say also we have another individual who is interested in prevention, who is younger, but they see a path that they're going down. They're like, I eat like crap, I feel like crap, I know I'm going to end up living like crap later on, but I want to change. What are some practical steps that you would suggest for that person to take maybe today that would hopefully get them on their path to change and hopefully go down a different area than where they are right now?
The first thing that's simple and easy, and this is for every patient, but especially a younger one, for 3 days, don't go home, don't change anything, and I want you to just write down your routine for me. What time do you go to bed? What time do you wake up? What are you eating all day? If you bite it, write it. I'm not here to give you a hard time about what you ate, but if you ate 5 M&Ms, write it down for me. If you ate 3 tamales or a fried burrito, write it down for me. What time did you go to bed? How much screen time do we have? What does your poop look like? Yes, I ask them that. When parents want me to work with their children, I ask them to do all of these things. And if they're not willing to do it, I'm not a good fit, because I'm not going to get those kids where they want to be. So even if this is a 20-year-old kid coming in, those are the first things I would say. Go home and do these things for me. And then come back. And I've done this in traditional medicine for a long time. If they come back and see you, they really wanted your help. If they didn't, they wanted to complain, and that's fine too. I'm here to listen to that too. But I can't help you if you can't give me that information, because I can't follow you around all day long.
So tell me about the importance of that. Because it's interesting you say that, and I have some thoughts on that. But why do you have them write everything down? Like, what is the idea behind that?
Because when they come back in and we go over that together, the first thing I say is, what did you learn from that? Yeah. Almost every single time, they can already tell me what they learned from that and where they need to make those changes. Yeah. Well, you don't think about it when you're doing it. When you're driving in the car and you're drinking the soda and you're eating the hamburger, you don't think about that. But when you have to write it down and you have to look at it at the end of the day or in 3 days, or you have to bring it to me to look at, it's that accountability. Yeah. And they already know where they can start shifting that. Yeah. I have a classic example of a 20-year-old kid who had been to cardiology. They were putting him on Repatha for cholesterol, if you're not familiar with that medicine. And he came back to me as, Mom, I mean, I've been seeing the kid for 17 years, I've been seeing him since he was 3. And the mom said, Lacey, what are we going to do with him? Like, I don't want him on cholesterol medicine and blood pressure medicine. He's 20. And I said, okay, well, let's talk about your diet. And he said, actually, I think he was 21, because he said, I'm drinking too much with my friends. And I said, same thing. I said, go home 3 days, keep it. I'm going to see you back in 1 week. Yeah. In 1 week, he came in. He had lost 7 pounds on his own in a week.
Wow.
And I said, what did you learn? He goes, oh my gosh, I was drinking way too much. I was eating too much. And just making those lifestyle changes mattered. And his family initially was like, oh, he needs a GLP, you know? Yeah. Yes, that's a great tool in the toolbox again, but if we don't fix the problem, the GLP is going to do nothing. We're band-aiding it. I call it skinny fat people. That's what we see walking around on GLP. So another classic example of peptides being used incorrectly.
Yeah.
You know, people have died taking GLPs because they get so addicted to the weight loss that they're getting them from 2 or 3 different sources and they don't realize how deadly they are. But that, you know, kind of getting back on track for him, it was like, where's your sleep? How late are you staying up? We started changing all of those things. The kid's 30 pounds down, looks amazing, feels amazing, and he doesn't need cholesterol medicine, and he doesn't need blood pressure medicine. Awesome. So if we can get it early, again, it's prevention. Let's not be reactive. Well, instantly we had to be reactive with him at 20 years old because he had high blood pressure and high cholesterol. But it's not a life sentence. Can we get you off some of those medications long term?
So what are some dietary recommendations you would give to our patients who are kind of in that similar position? Like, what would you say in terms of how do you approach that?
It's hard, number one. Our 12-year-old is a classic example. She's been meal prepping since she was about 9, and she meal preps better than I do, honestly. It's a protein, it's 2 vegetables, and a fruit. So the first piece of advice I would say is let's go 80-20. I'm not asking you to be 100%. You can't be. None of us can. And if I ask you to do that, you're going to leave and you're going to fail because you can't go, oh, I can never have the birthday cake. Oh, I can't have this. I can't have that. None of us want to be told no.
Yeah, exactly.
So let's try to find that 80-20. And what happens after they've done this for such a long period of time, 80% eating healthy, they don't feel well when they eat junk. And what do I mean by healthy? Let's get your fiber in. Let's get your green leafy vegetables in. The best piece of advice I would give parents is involve your children, engage them. I do it with our second one. I'm like, hey, you know, I really want you to eat some salad this week. Why don't you go to the grocery store with me and tell me what you'll eat this week? And you know what? She did it. We went this week. She picked out all the things she wanted at Sprouts, and we went home and we cut them up and make them help. Let's cut them up. Do you think you could try this? We try something new every day. You don't have to like it. It's a no thank you bite. But engage them. Let them start cooking, because how many times are we not cooking at home anymore?
Yeah.
And I don't care. You cannot eat out healthy.
No, you cannot. You cannot. It doesn't matter what anyone thinks. You cannot.
And I maybe shouldn't throw this out on the podcast, but I was so disappointed when I looked at the ingredients in Texas Roadhouse butter.
Yes.
Did you know that butter's not even the ingredient?
I did not know that, but it does not surprise me. It does not surprise me at all.
It's soybean oil and it's canola oil. It's seed oils. So that's the other thing I tell people in the beginning, like, just label read.
Yes, that's so important. See, Lisa, I think you hit it. Like, people think butter is butter. Butter is not always butter.
No,
it's not. That's a perfect example of this. Yeah, and you cannot eat healthy out. You cannot.
I'm all about you eating real butter. Yeah. Like, I believe in it. We do grass-fed butter at our house every single day. It matters, but it needs to be butter. You know, kind of back to the continuous glucose monitor. If I have patients either, you know, mid-20s all the way up into the older, it is the most eye-opening experience to see what will spike your blood sugar. If I take my Relight electrolytes in the morning, before I put honey in my tea, my blood sugar will not spike. If I use local honey instead of my New Zealand honey that's made from the manuka tree, my blood sugar will spike.
Talk really quick, what is the importance of that? What does that mean when your blood sugar spikes?
That's
what does
where
that mean
you're getting those insulin spikes. So that's where we're getting that metabolic dysfunction. And even for your kids, like, put it on their arm it's 2 weeks. It's $99 for 1 month supply, actually. It connects to their phone on an app and it tells you what is spiking your sugar, because what spikes mine may not spike yours. That matters. So if oats spike your blood sugar, or bananas, then we need to pair that with a protein. And it kind of proves to you too of always pair a protein with your carbohydrate. That matters all the way down to your pediatric people. Go give your kid a donut in the morning with no protein and see what happens.
Now we mentioned briefly sleep, and we didn't get a chance to talk about that in detail, but sleep is an issue for a lot of people. Sleep, you know, it really is a root cause for a lot of problems.
Absolutely.
And I think part of the beauty of functional medicine is that not only do you take care of one part, you take care of the whole part. So talk to us about the importance of sleep, and maybe also talk to us about how functional medicine helps to manage sleep. And I think I would love tips on what I can do to improve my sleep for sure. So tell us about that. Like, how does sleep play a role?
So I've kind of gotten into the world of the wearables. I don't want you to get so tied up in them and get so focused on them that that's all you look at, but it does give me a good baseline. Whether you're wearing a watch or you're wearing an Oura ring or whatever you're wearing, let's look and see what your pattern's looking like. What time are you going to bed at night? Again, it's screen time, it's decompression. Are you using blue light or red light glasses to kind of get, your TV's blue light, your phone, all of those things that are keeping you wound up all night long. Caffeine. is another thing. Keeping your bedroom cool, keeping it dark. I prefer not to have a TV at all in the bedroom, if you want to know the truth. I think it's important. Our kids don't have a TV in their bedroom. When we're done, we're done. Take those iPads away from those kids an hour beforehand. They can read or do things like that. There's some great supplements out there for sleep. I love Magnesium Breakthrough. It's made by BioOptimizers. We carry it in the office. It has 7 types of magnesium in it. And then they also make a sleep breakthrough, which has L-theanine and things like that in it. If that's not enough, particularly for women in the perimenopausal phase, menopausal phase, progesterone is a game changer. It's a game changer for mood, it's a game changer for hormones, but it is a fantastic sleep aid. I'm not big on melatonin long term because it can disrupt some of your hormones, but some people do well with that. So those are just some of my little things. Magnesium for your kids, amazing. L-theanine sometimes can cause GI upset, so we've got to be a little bit careful if they get a tummy ache with it. But magnesium's the #1 depleted nutrient in America, and not just because we don't get it, but even what our plants are now being grown in, the soil is so depleted of the nutrients that even if you are eating what we consider clean or healthy, you're still not getting those nutrients.
So you mentioned a lot about kids, and you know that was a passion for you. I mean, you've taken care of kids for a long time. And you also mentioned, too, that we're seeing a lot of metabolic disease in kids, which is crazy. So talk about kind of your approach with kids. How do you help manage that? And how do you help prevent kids from starting on that path where we're now at, we have to, stop and, stop whatever's going on? Like, how do you approach that?
So it's a very delicate situation.
Yeah, kids are hard.
They are hard.
Goodness.
And you can actually cause a kid to have an eating disorder by bringing them in and asking these questions. So I'm very cautious and very gentle about it. Again, I'm asking the parents to please help me in the beginning, because if you don't get the parents on board, if they're feeding their kids fast food 7 days a week, it's going to be really hard for me to change that, dynamic in the family. So the family has to be on board, #1. But again, engaging those kids, talking about why those vegetables are important, why are those fruits important. Our 4-year-old or 6-year-old, as we're driving down the car the other day, he's like, Mom, when I was 4, I could not see this and this and this in the car, but now that I'm eating carrots, I can see all of those things clearly. So even if it does take a little bit of reverse psychology of, hey, you're seeing better because those carrots are really helping you, putting them in soup. When I make spaghetti sauce, I grate zucchini in it, I grate carrots in it. They will never know it. They will never see it. They will never taste it.
Exactly right.
You can blend cottage cheese in a protein shake, and they're getting extra protein. They're getting that fermented food. You can use kefir milk. You can use yogurt. So even though they may not like that texture or that taste, when you're covering it up with that, they will eat those things. Getting them up and getting them a healthy breakfast. Even at our house, it's hard because they go to school and they eat breakfast after I fed them breakfast.
Yeah.
So you really don't know what they're having at the end of the day. You cannot harp on them. That has probably been the thing that we've learned, by trial and error with our own children. Every conference we come back, they're like, what now, Mom? Like, what else do we have to do? And at some point, you can't just keep going. You can't have sugar. You can't do this. You can't do that. Because again, it's like you and I, somebody telling us no all the time. That's what you crave and that's what you want. And it takes a really long time to get them off of sugar. And getting them to all the added sugars and things. So how can we make things that we sweeten with either honey or real maple syrup? And syrup's another one. How many syrups have high fructose corn syrup? There's no maple syrup in them. They're just high fructose corn syrup. So making those snacks that they do enjoy and that they'll go home and actually eat, or they'll take to school and they'll eat those things. So we use Greek yogurt and we use bananas, and I use oat flour in muffins and things like that. And praising them for, hey, you're doing a really great job. I know it's hard when they go to school. We've seen kids that are teased because they eat cottage cheese or they eat vegetables or they eat salad, or, oh, is it because you're worried about your weight? No, it's about their health. And let's start teaching them those things, because when you're seeing diabetes in these young children, the thought of them losing their eyesight, their kidneys, their legs, that's scary to me. What if they never drive because their eyesight is so bad by the time they're 16 from diabetes? So those are conversations I start having with them. It's not about weight. It's not about what your body looks like, but it's about how we feel. It's about living longer. It's about living healthier and being able to do the things you want to do. Can you follow your friends? Can you roller skate? Can you ride your bike? Can you go play baseball? It's just like telling a grandparent that. Can you get on the floor with your grandchildren?
Yeah, it's scary, just the rise that we're seeing of metabolic disease in young kids and the consequences that we are seeing and we're going to see. And I think you're exactly right. We're on this path now where everything is sugar-laden, everything. And everything is additives, emulsifiers. We have no idea what's in our food now. And it's just, and it frankly tastes good. So kids want it. It's hard. But you mentioned it before, it takes modeling, it takes patience, it takes encouragement. And it's hard work, but the result of having a healthy kid that is not on meds, that lives a healthy life and understands the importance of it, you can't put a price on that at all.
It's worth it.
Yeah,
And
it's worth
even
it.
as a parent, you get scrutinized.
Yeah.
We don't let your kids have this. We don't let them have that. How come they can't have this? It's not that I'm being a mean mom.
Yeah.
It's that I care about them. And I even joke with our kids sometimes, but I'm really not. I say, I love you more than your friends' parents do then.
Yes.
And that's all I can tell you is I love you more. And I do care about, why are we seeing childhood cancer is the #1 killer in pediatric patients.
Yeah.
And we know that cancer is not all genetic.
Yeah.
It is metabolically driven.
Yes.
You are hosting an environment, you're creating an environment to host a cancer, whether you're a pediatric patient or an adult patient, for years and years and years and years. And it's that metabolic dysfunction that we're dealing with. And with your pediatric patients, because of our food sources, they do need to be tested for things. You know, an American Academy of Pediatrics says, let's check a CBC and a CMP. We might check a lead level. We're not going to check their cholesterol till they're probably 11. And then we're going to check it again about 20 or 21. So that's the guidelines that we're taught to follow. But realistically, if you have a kid that's getting the stomach bug every single time they're getting sick, every single time during sick season at the school, what is their vitamin D?
Yeah.
If they're having ADHD symptoms or they're having mood symptoms, what is their B vitamin level? What is their ferritin level? Because if they're eating all processed meat, you and I both know they're not getting any ferritin, they're not getting any iron, they're not going to get green leafy vegetables that are going to give them the micronutrients they need. So I do believe in getting blood work for pediatric patients. No, I don't like kids being hurt, but a finger stick, a blood draw, and knowing where they are matters. And I believe that pediatric patients need vitamin D3 and they need K2. And if you're taking only D3 without K2, whether you're an adult or pediatric patient, it's still one of the biggest mistakes I see today in my practice. I saw it this morning before I came over here. They're taking only vitamin D3 because that's what the provider told them to take because the insurance would pay for it.
Yeah.
But we're pushing calcium back into the heart and the blood vessels instead of pulling it back into the bone and the teeth with the K2. So we're really doing, again, more harm than good with something natural.
Yeah.
So really getting all of those, getting a good baseline on those pediatric patients matters to me. And just trying to get them, making them understand why we're doing what we're doing. And a lot of times, talk to them. Educate your kids. They are interested in that. And when they know the why behind it, they're more interested to do it.
And just to clarify, you see pediatric patients.
I do.
And you will continue to see pediatric patients.
Absolutely.
Okay.
In fact, it's a passion of mine. Like, I would be full-time pediatric functional medicine if I thought it would work. But I love helping the adult side of it too. But just seeing these kids struggle through school and seeing that they're either sick all the time or they don't feel good or they're having behavioral issues or the teachers are having a hard time with them. How can we correct that? How can we make that better?
GLP-1s, they're everywhere. Oh my goodness. It's like every single commercial is a GLP-1. Every single patient, like every other patient's on a GLP-1. They're seeing me for their GI issues. So talk to us about kind of GLP-1s, your approach. But I don't think people really understand some of the side effects that can occur with that when you don't take it correctly or you just take it willy-nilly or you don't have somebody who's watching that. Tell us about this.
Right. And I think they're a great tool in the toolbox. You and I both know they're great for cardiovascular health. There's some studies out right now on the prevention of Alzheimer's and dementia, which they're now calling type 3 diabetes. So I think there's great benefits. There's anti-inflammatory benefits for patients with autoimmune disease, but there's risk. And I have patients who come in that have lost half a head of hair, you know, and initially they blame it on their hormones. They're like, oh, my hormones, Lacey. That's why I'm like, I've been doing hormones on you for 12 years.
Yeah.
The only thing we have changed is we've added a GLP, and I am monitoring those patients. Again, we're not the cheapest, and we're not going to give you a year's worth of a GLP, and we're going to look at an amylase and a lipase and make sure you don't have an underlying gallbladder disease, pancreatic issues. Are you a heavy drinker? Because then it's going to make those symptoms worse, while it should help kind of with that drinking and hushing the food noise. Just know it doesn't come without risk. So we're seeing decreased libido in patients. We're seeing a flat affect because it is affecting dopamine. That's what's shutting the food noise off. That's what's shutting the alcohol noise off. But you have to remember that that's also at the cost of shutting off the dopamine for your mental health. So then you're depressed, or maybe you're having anxiety, or fatigue has been probably the #1 side effect I see. They're like, I'm just so tired. I've never been this tired on lowest doses.
Yeah.
I could tell you that none of my patients personally are on the highest dose of a GLP. It's not necessary. There's microdosing. There's so many different ways to do it, but you need to have a provider relationship. You need to have that provider-patient relationship. I need to know that you know how to take that medication if we're microdosing it or we're not taking it on commercially available products. So, and some people come in and they're like, I don't care, I want to be skinny. I'm like, okay, well, if you want to be bald and you want to be depressed and you want to have no libido, but you're skinny, I get it,
yeah.
but that's not really, I'm not recommending that, and I don't respect that, you know, and it's really hard when you keep coming in and they're just complaining about the same thing, but they're not willing to stop that GLP.
Yeah. So do you see these side effects common in these patients? I guess in terms of, it's hard to give a percentage, but is it quite a few you see who have these side effects? Is it just certain individuals, certain populations? Who do you commonly see these side effects on, or is it just random?
I feel like I'm seeing it more.
Really? Okay.
In the beginning, I've done hormones for 12 years,
Yeah.
you know that. So I had all of these patients, and they were coming in, they're like, my pellets aren't working. My pellets aren't working. And I'm like, okay, Lacey, like, I haven't changed companies. I haven't changed my procedure. Their weight hasn't changed. I haven't changed their dose. What's changed? Yeah. And then as I started putting all the pieces together, almost every single one of them, it was a GLP.
Wow.
Not all of them, but
Yeah.
most of them were a GLP. And you may be familiar that there's actually a gene testing out there right now that some patients respond better to oral berberine than they do injectable GLPs. Well, the gene test is expensive, you know, maybe $1,500, $2,000. Well, let's try the berberine, and then let's decide if we want to add the GLP in. And that is what I do with some of the patients. I just say back off of it for a little bit and see if your symptoms get better. If they don't, fine, I'm wrong.
Yeah.
You know, that's fine. But let's back off of it. Let's add some berberine and let's see what happens.
Yeah.
Again, berberine doesn't come without risk. What do your liver functions look like? Some patients, I've seen that the liver functions begin to rise after that.
Yeah.
I have patients who get gallbladder disease on GLPs and they will not stop them.
Really? Wow. They're like,
like,
I want to get skinny and bald.
That's
all
exactly
I want.
right.
Yeah.
That's a problem,
Yeah.
you know? So, yes, I think they're a great tool. I think that it has drastically changed patients' lives. I have seen it change their metabolic dysfunction, and I love that part of it. I've seen triglycerides change. I've seen good cholesterol, bad cholesterol, total cholesterol completely change with GLP. So, yes, I love them. I think they do a great job, but it's still, you need some supervision on those. I have seen Facebook posts of regular people I know that are like, contact me, I get GLPs at a wholesale and I'll sell them to you cheap.
Oh my gosh.
No medical expertise, and you may have seen the article, a principal just got arrested for that, for selling GLPs to his staff.
Yeah.
That's a problem.
Yes.
That's practicing medicine without a license, really.
Yes, that is a problem and illegal and not good at all.
And it is, they got him because it was distributing a dangerous drug. It is a dangerous drug when it's not used in the right context.
Correct. A topic that people don't like to talk about, which I think is a common problem that people have, is sexual dysfunction, lack of intimacy, just not feeling the same with your partner as you used to. There are reasons, medical reasons, which you understand. We get older, things change, whatnot. Okay, we understand that. But there are other, I think, underlying reasons that are a little bit more deeper, root cause that could cause that. So maybe kind of talk about a little bit about that approach when it comes to how you approach functional medicine and when it comes to sexual health.
So sexual health has been a big part of my practice for the last 12 or 15 years. People in my area know that I'm the person. That's who they come to. And with this next step, with next phase longevity and with holistic and functional medicine, it's going to be an integral part of it. Because you're right, it does matter, and most relationships are made on sex. And when that begins to fade, then you start having issues, whether you're not happy, you feel lonely, now you feel like roommates. It matters. That natural oxytocin matters. Now, peptides do come into play there. There's lots of peptides that help with libido, but did we look at the underlying cause first? Is it high blood pressure? Is it a cardiovascular issue? And the other thing, I kind of have this saying about marriage and how do you stay together for a long time and how do you stay together happily for a long time? And we're going on almost 25 years.
Congratulations.
And you have to learn to love a different person every day. That's the best way I can put it, because who I was 25 years ago is not who I am today. And Keith always kind of jokes, do you want to be with the 20-year-old immature woman, when you're 50? And maybe some of you do, I don't know. But you go through different stages in life. Maybe you went through sickness, maybe you went through illness, you've gone through death, you've gone through grieving, you've gone through births of children, you've maybe had difficult children, you've had, a job change, a career change. There are things that we change every single day, and you have to learn to meet that person where they are.
Yeah.
That matters. So I think that's a big part of holistic medicine. And if your provider's not talking to you about it, if you do not have a healthy sex life, there is something that needs to be addressed.
So how do you approach that then, from a functional medicine standpoint and from longevity, kind of the non-traditional medicine approach? How do you approach that? Like, how do you deal with that?
Well, and so many of my patients are so comfortable with me because I've seen them for 20 years. They bring it to me, or they'll say, hey, I talked to so-and-so at the coffee shop about, and I know exactly where they're headed. But I just outright ask. I ask the question, are you sexually active? How many days a week are you? Are you happy with that? Are you having any painful intercourse? Are you having morning erections? How many erections are you having during the week? Can you maintain an erection? Just ask the question. People will answer it, but a lot of times they're not going to bring it up if you don't ask the question, and you're not going to know the answer if you don't ask the question.
And so how do you approach somebody who's having a problem? Like, how do you deal with it?
So labs first.
Okay.
Let's look at some blood work. Really, it's a history thing first. Backing all the way up, labs would be next. But what is your relationship status? Are you happy in it? Do you feel safe in it? That's a big thing. Do you feel loved? Have you maybe been through some trauma that we need to address, and we need to get you in the right place to get that help? Can you communicate with your spouse? Those are all questions that need to be asked first. And then just going over their med list. Something as simple as a blood pressure medicine may be causing your erectile dysfunction, and we can change that blood pressure medicine. We're going to keep your provider happy, keep your blood pressure good, and make you better because we're going to fix that erectile dysfunction. And if we've done all of those things, then let's move to the next step. What does your testosterone look like? Can we add a supplement? Or maybe we need to talk about Cialis, which actually is a repurposed drug in longevity right now. It actually has a lot of really good benefits other than just erectile dysfunction. And if that's not enough, then do we need to maybe talk to somebody and see what else we can change to make that better?
So if someone is interested in learning more about kind of sexual health, they're like, yeah, this is me. I have this problem. I don't know what to do. How can someone approach? How does someone come to you? How does someone approach you? What's the best way for that?
I set them up for an appointment and kind of go over that whole review of systems. Let's do a review of findings. Bring me all your blood work. What have you tried? What can we do different? What does your lifestyle look like? What does your diet look like? What does your sleep look like? How is your stress level? And I just set up a consultation with them and make a plan.
All right. So Lacey, we had a great conversation. We talked about a lot of topics which I think are important in healthcare, but also important for patients. If someone is watching this or listening to this, they're like, yes, I want to find out the root cause. I want to live longer. I want to improve my sexual health. I don't want just some pill popper to give me something. I don't want some peptide popper to give me something. I want someone who cares and understands what's going on. How can they get in contact with you? What is the best way to reach you?
So the new business is Next Phase Longevity, and I have that still going in my Farwell location at Farwell Family Healthcare, and then that Next Phase Longevity is also going to be coming to Lubbock in the next 6 or 8 weeks on 114th and Quaker. So nextphaselongevity.com, and then same thing on the Facebook and Instagram. It's under Next Phase Longevity.
And so they're able to find that. They're able to make an appointment with you,
Yes.
set up a consultation, and hopefully go into more details about individual plans to get them on their health that they need, live longer, live better, and hopefully live more fuller lives.
Right.
All right. Well, Lacey, I want to thank you for having us on. Hopefully, this is a much better version of the podcast.
I think we did better.
I think so, too, than what we had from before. I think this is going to be a very popular podcast, a very important topic we have a lot of patients have. So I appreciate you coming in. I think your wealth of knowledge. I learned a lot. I know my audience learned a lot. And I think patients are learning more about what to do, what not to do, but also the importance of just having somebody who knows what the heck they're talking about. I can't. It's
important.
It's important, and I cannot understand people are just doing things that they don't have either good guidance, they don't know what's talking about, they don't have certifications. You have all that. I want to thank you for coming on, and I really do appreciate your time.
Appreciate you.